Hey, Chris.
Hi, Terry.
I can't hear you.
Can you hear me now?
No, it's really low. Hold on, let me just see if it's the volume on my side. Chris?
Yes. How's this?
That is better.
Just better, or do I need a mic?
No, do a little bit higher. Can you do a little bit higher?
Yes. I think I just have so many connections here. Everything's plugged into this, and that. I'm gonna put on my mic anyway, and
Yeah, you know what? Just a confidence level there, right?
yes.
Okay, I'm gonna pull up the PowerPoint. So I just sent an email to everybody to log in at 6:45. Sam sent it back and said, "Don't you mean 5:45?" Like, whoops, yep.
Oh, okay. I kind of skimmed over that, and I didn't know what was going on, and I thought you meant. I read 45, and I was. I read 45, and yeah, I knew. Like I know I'm supposed to sign in right now, so. All right.
Okay, and you have your run of show?
Yes. Right in front of me.
Okay, I want to open mine up. Oh, you know what?
Does it sound any better?
It's about the same. Talk a little bit.
Testing, testing, testing.
It's a little low, Chris.
Low? Really?
Yeah,
okay.
but my volume. Let me turn my volume over. Okay, go ahead.
Testing, testing, testing.
No, it's great.
Okay. I switched it from the computer to the microphone.
Okay, so I changed up a little bit of what you're saying. Oh,
okay.
You're gonna, in the beginning, you're gonna put up the poll. I've got to get Mina on so that she can.
That's right, the poll.
Yeah. But we'll see. If I can't get Mina on here, we can't. Hey, Sam.
Hey, Terry. Hey, Chris.
Hey, Sam. Good to see you.
Yeah, likewise. It's been a while. So we need to be made co-host, right?
Yep. I'm going to do that right now.
Did you set up the meeting or Mina so that everybody's muted when they come in?
No.
Otherwise, maybe, I mean, someone would have to probably monitor that and just kind of mute people.
Mm-hmm. There you go. Just did it.
Oh, great. And do you have a slide with the dates of the future meetings, Terry?
Don't. I don't, but would you like me to create one? See if I can do that?
If you could, do you have the dates right offhand?
I don't, but let me just see where. Okay. I mean, Mina can't get in.
Why?
I don't know.
There's an Adrienne Allende. Do you want me to admit her?
Yes, please. That is our bookkeeper, Sam, who is living with lupus.
Okay, I'm letting her in.
Good. Hey, Adrian. Okay. And then we've got Monique Thornton on here, which is great. She's an awesome advocate. Hey, Monique.
We're going to be muted.
Yeah. Okay. Let me. Gotta ask him.
Hello. Can you guys hear me?
I can.
Okay. Hello.
Hey, Adrian. How are you?
I'm good. How are you?
I'm good. I'm good.
I'm trying to get myself situated. I just walked in the door.
So you're good, Adrian. You're gonna be one of those offenders with the background music.
I got a million. Every.
Okay, I'm muting. Adrian. I'm muting you.
Take my. Okay.
Okay.
I wish I had one of those
Hey,
backgrounds like Sam
Mina
has.
can't get it. I've got to send her. Hold on.
No, this just looks good.
Terry, I've got the I got the slide made. Okay.
Oh, fantastic.
Yeah.
Okay.
You said you needed me to do what, Terry?
I put you on mute because you had a lot of background noise.
Yeah, I know.
You're one of those offenders, Adrian.
You know, I got a little person running around.
Okay. Hey, Kim.
Hey, I'm trying to change my background. How are you?
I'm good. How are you? Okay, so I just wanted to let you guys know ahead of time. Sam and Kim, we had an issue with the Grubhub.
Yeah,
Okay.
I know.
Well, they've got a high fraud alert, so they would not allow us to send multiples. So the first few went through, but they won't allow any additional ones to go through. So Mina sent a great email, and she said we'll reimburse them the 35 tomorrow for anybody who didn't get it. So that's how we'll handle it. It's all we can do. I mean, I called the bank, I called American Express, I called all that. It's just that they're not gonna.
Yeah. Well, I'm sorry about that.
Yeah.
It's okay. It's
That's
all
not
you
your
can do. I'm
fault.
sure it has to do around. I've had worse. I've had worse.
Let me get that filter to blur.
Okay, Mina can't get into the meeting. And I'm trying to get her in. There we go.
Can you unmute Brandy and make her co-host?
Absolutely.
Thanks.
Hello.
Hey, Brandy.
Brandy, how are you?
Good. How are y'all doing?
Good. Thank you so
Good.
much. Hey, Brandy, I did want to ask you, we'll give you screen control for you to share your screen for your
Okay.
slides. Is that okay?
Yeah, that's great.
Okay, perfect. Thank you so much for doing this.
You're welcome.
You're awesome. Okay, I don't know what to do here. I'm sending the, I don't know how to get Mina in here.
What is she saying? I mean, all you gotta do is hit the link.
He's saying that she didn't get the email, even though, okay, I just sent it to her again. Okay, that's okay. It's probably an issue somewhere else. It's not, we will figure out. And she's juggling a lot, so she's doing a great job. This is why we get on early, to figure these things out.
Forgive me. I'll be doing family stuff for a little bit, but I'll be paying attention and I'll be back on camera and unmuted when it's time.
And you got to
Understood.
run a show and everything from me, correct?
Yes, I have that.
Okay, fantastic. And I really
Yeah.
appreciate you. I really appreciate you, Brandy.
Yeah,
I did get
happy
an
to.
email about re-signing that contract, and that'll happen after this meeting tonight. Okay.
Okay, great.
Thank you.
Thanks.
Hey, Terry, can you make Kim co-host and unmute her?
Yeah, she was before, but she left and came back. What happened?
Yeah.
Ask her.
I had to figure out how to blur it. So I love it. Okay. Thank you.
There you go. And Sam, I appreciate you checking on this for me.
Oh, yeah. Team effort.
There you go.
Hey, Chris.
Hey, Mina's in.
He's in. Awesome.
You gotta make her co-host too.
All the
And
speakers.
Senator Anderson as well.
Hello, all. Sorry, I've been trying to just go over my notes. But good to see all of you.
Okay. I don't know if we're going to get to do the poll.
Without Mina on?
What? That's the whole point of this meeting, is to do a poll.
You stop,
If we don't do a poll, we can't have a meeting.
It's done.
please. I just got off the ceiling. I just climbed down off the ceiling a few minutes ago.
Oh, Terry, you are so cool. Calm.
Right. It's all a facade. It's all a facade. I'm going to see if Mina has time to do it.
I'm here. You need me to do the poll.
The poll. So all you're going to do is go from the Eventbrite and just put in the questions for the different, what is your interest? And
Okay.
Chris will do that in the beginning, and then at the end of his 5 minutes, he'll post the results. Fair
Okay.
enough? Okay. Thank you, dear. And did I make you a co-host?
Okay, they're coming in on mine, so am I now admitting everyone?
Anybody who can admit everyone.
I'm not a host, no.
Okay, let me
Just
make,
admit it. Did someone just admit it, Dorothy?
Yes, I did.
Okay.
I made you a co-host, so you should be able to do it. Let me know if you can do it. Hey, Dorothy, how are you?
She's probably muted.
Yes, she is.
We should remind people periodically that they're muted and to use the chat and
Mhm.
only loud people like Representative Schofield are allowed to have audio.
Mute myself.
Terry, do you just want me to drop it in the chat, the question?
I'm so sorry.
I said, do you?
It says polls down to bottom. Do you see that?
I do not, but let me try and come back in. Maybe I'm the one who is Yeah, let me try and come back in real quick.
Are you gonna leave and come back in?
Yes.
I don't see a poll on mine down the bottom either.
Yeah, she may not, don't, she left.
I don't see it on my end either. I think she
Okay.
can do a poll in the chat though.
Well, she may need to be a host. But a co-host should be able to do it.
So Terry, is this poll going to be a pop-up poll, or it will exist as?
Usually sort of pops up as a small separate screen.
Right.
Yeah.
Okay. So it will not be in the chat. If we get it in place, it will not be in the chat. It will be in a pop-up.
That's how I've usually seen it.
Hello, Dorothy. It is so good to see you, my friend.
I'm sorry we've muted everybody else, but
That's all right. Hello, everyone. Good to be here.
Good to see you.
Same here, Dr. Lim.
This is the only time I ever get to see you because you're just so busy.
I'm sorry. We can
No.
see each other whenever you say, sir.
Never apologize because you're doing great things and I don't want to be in the way.
You'll never be in the way.
Okay, now you can make me a host.
Make you a co-host. Can you see the poll as a co-host? Maybe not.
I can't.
You can?
No.
Okay. Then I would have to do the poll. And I'm sorry, you guys. I don't have the bandwidth to do that. Sorry. I've got to be realistic with it.
So no poll.
Hey, Charmaine, I finally get to see that beautiful face. The only 3 of them we've been on, and I haven't seen your face today.
Terry, you can email us the poll at the end of the.
Yeah, we'll do it as a survey. We just thought it might be a fun thing to get people engaged. Okay, you know what I'm gonna do? I'm gonna do a. Okay, I'm not gonna try to do this poll because I'm getting texts and emails from people. So I want to be mindful of that. Okay, we'll give it another minute or so before we get started.
Sure.
Hi, good evening, everyone.
Hi.
Good evening.
Good evening. Okay, I'm going to go ahead and share my screen. Do you think it's fair enough to get started now? We have about 28 people on.
Yeah, I think this is a good time to start.
Okay, can you see the screen, Chris?
Yes, I do see it. All right, good evening, everyone. My name is Chris Reed. I'm Advocacy Chair and Project Manager for the Lupus Foundation of America Georgia chapter, as well as former chair and member of the Georgia Council on Lupus Education and Awareness. I'd like to welcome all of you and thank you for taking time out of your evening to participate in this event. This is our third Georgia Lupus Collaborative Workshop, and I'm looking forward to hearing what all of our speakers have to say. Just a few housekeeping rules. All microphones are currently muted during all of our presentations. There will be time for Q&A at designated points during this workshop. So please, if you do have questions or concerns, please post them in the chat. We do have 2 individuals who will be assisting with those, and then if you do have questions, we can certainly address them at that time period. So just to tell you a little bit and give you a bit of an introduction, in 2015, State Representatives Kim Schofield, Dr. Sam Lim, and myself, we were appointed by Governor Nathan Deal to the council. And during our first meeting, we brainstormed on ideas on what the Georgia Council on Lupus Education and Awareness, or GCLEA, which we'll reference it many times today, what that council is going to look like. What is it going to do? We held our first stakeholders meeting workshop in 2016 through a grant from the American College of Rheumatology and the National Association of Chronic Disease Directors. And now this year, 2021, we are holding this workshop. We would like to disseminate certain information to you about some existing lupus and related initiatives in Georgia, some of which have been spearheaded by the GCLEA and some of them by its members. Our goal this year is to inspire you in your individual organizations. We ask that you keep an open mind and formulate how you and your organization may best contribute ideas discussed today. We do ask, again, that you save any comments and questions for the discussion period. We will certainly entertain those questions at that time. And again, please enter those into the chat. At this time, I'd like to introduce Dr. Sam Lim, who will be our first speaker. Dr. Lim is an epidemiologist and professor of rheumatology at Emory University School of Medicine, Division of Rheumatology, and the Rollins School of Public Health. He is also chief of rheumatology at Grady Health Systems. He directs the Grady Lupus Clinic, and he is the principal investigator for Georgians Organized Against Lupus Research Cohort. I've had the honor of working with him on the GCLEA for the last 6 years, and working with him on many other projects. He is now the chair of the GCLEA, and he'll tell you a little bit more about many of his projects at this time. So I'm going to hand it over and welcome Dr. Sam Lim.
Thank you, Chris.
You're welcome.
Let's see, switching over here. Everybody hold their breath while we do this technical stuff. Can somebody verbally tell me if they can see this or?
Yes, we can.
Okay, great.
Yes, Sam.
Well, thank you all. It's wonderful to be here, and I'm sorry that we can't be in person. I mean, the impact is less, but the importance is not lessened at all. And our unity isn't dissolved by any means. And so it's great to be together virtually tonight. So my charge is to talk a little bit about social determinants of health. And for those of you who don't know the term or may not be as familiar with it, it's a very broad term. As you can see, the WHO, the World Health Organization, defines it as conditions in which people are born, grow, love, work, and age. Now, if that is extremely broad for you, it's meant to be. It really encompasses everything. And it encompasses everybody. I mean, we are all in environments that involve education access and quality, healthcare access and quality. But beyond that, into our own neighborhoods and the built environment where we live and we grow and we interact with those around us. And the actual environment that facilitates those interactions impact the social and community context by which we grow, love, work, and age. And then, of course, there's the economic stability that underlies the environments across all of those domains. So no matter who we are and what we do, we all know firsthand, we're experts in the social determinants of health. We know that all of these domains and many more impact each one of us, and it impacts us in terms of our health in profound ways. And these factors can contribute to health inequities and act as barriers to consistent care. So in terms of inequities, it's one of the things that we focus on in our group at Emory across a variety of things that we do, not the least of which is the goal cohort that I'll talk about in a minute. But just to be clear about what we mean about disparities, these are health differences that are closely linked with social, economic, and environmental disadvantage. And these health disparities adversely affect people that have systematically experienced greater obstacles to health based on either their race or ethnic group, religion, socioeconomic status, gender, age, mental health, cognitive, sensory, and physical disability, sexual orientation or gender identity, and geographic location, or other characteristics historically linked to discrimination or exclusion. So what we are very focused on is better understanding how this totality of the social influence, which really has been understudied, generally speaking, in diseases and chronic diseases in general, but specifically in lupus, but also germane to lupus, are the disparities that we see that are very heightened, especially with regards to race and ethnicity. So many of you have heard of the background of GOAL, but for those of you who need a refresher, it really is a, sorry, I'm just doing this here. It's a research cohort that was derived out of a CDC-funded effort to identify as many people as we could with lupus in the Fulton and DeKalb counties. And that was about a couple decades ago, but since then we built on that initial effort to develop a broader cohort where we interact with the individuals that have lupus, not just defined by Fulton and DeKalb, but expanding out into the metropolitan Atlanta area, and even further beyond that we'll mention later on in the meeting. And we've grown to over 1,200 participants. And because it leverages this initial CDC effort, it's not defined just by Emory or Grady. It really is to try to capture a broad spectrum of people that not only is defined by the doctors or the healthcare systems that they interact with, but by the socioeconomic spectrum and the disease severity spectrum. So we have an extremely broad group that not otherwise would be very easy to follow in a research cohort. So at a fundamental level, we've been following these wonderful individuals. Many of are probably on this meeting right now through annual surveys, but we've also had opportunities to interact by collecting biospecimens and linking to other databases for outcomes. And part of what we've discovered over time are the amazing work that still needs to be done in terms of improving people's outcomes who live with lupus. And we also see a lot of racial disparities along with that. And you can see here that over here on the left in work loss, when we defined people to follow in the gold cohort who at the time that they were originally diagnosed with lupus were working, and what happens over time, this is going left to right. And so everybody started here at time 0 working, and then the higher you go up on the y-axis here are the percentage of people that have lost their jobs. So the middle line is everybody here, and you can see how dramatically it goes up. And really by the time that you get to about 20 years, you're talking 60 to 70% of everybody with lupus loses their job. And then when you look at it with respect to racial groups, those who identify as being Black compared to white have dramatically increased risk of losing their job. But this is a universal issue that just disproportionately afflicts certain groups. The middle group here is what happens over time with end-stage renal disease or kidney disease, kidney failure. And for those that were originally diagnosed, and over time, up to 8 years, just in the first 8 years, you're talking nearly 12% of people have kidney failure, which is really unconscionable at this day and age. And this is where there's significant racial disparities. This line is basically all those who I'd self-identify as being Black. There were relatively few people who are white to form a statistically significant line. These certainly catch up as time goes on and are affected in equal ways. Over here on the right is mortality. Again, starting at time 0, from the diagnosis, you can see there are differences between Black and white over time having mortality. But basically at 14 years after diagnosis, you're talking anywhere from 20 to 35% of individuals, unfortunately, have left us too early. So this is just a hint. And what's underlying this? What are the factors? And we can just go purely on the socioeconomic level. And over here at the bottom left, you can see that 4 out of 10 of the individuals in our cohort, and again, these are not all Grady, not Emory, not all Northside. This is across the board throughout all communities and colors. We're talking 4 out of 10 live at or below the federal poverty level. And so certainly that alone tells you the influence there, but that is a marker of so many other things that we mark as social determinants. These are unpublished results, but it just gives you a sense, and many of you know already what it's like to live with lupus. But as a group, as a community, in and around Atlanta anyway, this is the burden that we carry in those whom we love or care for or who we are that have lupus, that nearly half have some form of significant stress. But when we're talking about moderate to severe stress, the kind that really can change health, nearly a quarter suffer from that. We talked about the poverty level, and that can give you a sense of the neighborhood and the surroundings that people live in. A quarter live in neighborhoods where they do not feel safe walking around. Characteristics of individuals that have lupus, about 67% have a hard time asking for help. Many develop lupus at the time when they are getting up and going in their families, their careers, their education. And to develop a chronic disease, it may be a skill or a characteristic that's very difficult to integrate into their daily care. As a result, many neglect their health. We don't talk too much in the lupus world. We should, because like other chronic diseases, the issue of food scarcity is significant in Atlanta as well in general, but nearly 17%, 18% of our families with lupus don't have enough to eat. There's a lot of stressors that come from being sexually abused. There's a lot of difficulty overcoming these issues, and many have almost given up trying. And as a result, people feel isolated. So, these are just downstream symptoms, if you will, of many factors of the environment, the social environment that is tied very integrally with lupus. Just to give you a sense of the areas that we've been studying is because of the disproportionate impact of Black Americans with lupus, we wanted to explore unique psychosocial stressors in that community. And of course, we actually started this way before the recent heightened attention, which really has been there for obviously generations. But we had published this as way back as 2015. But when you control, meaning statistically remove the effect of the duration of having lupus, age, medications, many other factors, and you try to isolate the effect of racial discrimination and lupus activity and damage, there is an independent association. In other words, discrimination impacts the biology of people with lupus. It increases the immune reaction, it causes disease activity, it causes damage. And perhaps, in part anyway, that is what's contributing to the racial disparities that we're seeing. And if you're not familiar with the term vicarious racism, it's just experiencing it secondhand. That's enough to, in many individuals, trigger similar responses, and it's been associated independently with greater disease activity. So this is an overall conceptual model of what our group is doing along the lines of these social determinants and how it influences lupus. And I'm going to go through this in a minute, but I'm going to move away from talking about what we are doing specifically at Emory and the GOLD Project, and remind us that this conceptual model is where we're all interacting, hopefully in this collaborative through the GCLEA. This in a way is one example of all of us being able to help each other and touch on various topics so that we can paint the picture of what's going on in lupus. We can find the areas where we can make a difference and ultimately improve the lives of our citizens that are suffering from lupus. So let me just walk through this. I know it's kind of complicated. So the bottom here is this area called social determinants that we just talked about. And this is a model specific for the GOLD project. So we do have specific measures that we're trying to obtain and to analyze and figure out how it's contributing to people's lives in lupus and their outcomes. So we're focusing it on an individual basis, and I just talked about racial discrimination, but also if you want to talk about stigma, having lived with lupus, what the burden that people carry as to how they may be ostracized or marginalized in society. An obvious example would be somebody with very significant skin scarring and to be seen as different right away, to be pushed aside. That how does the environmental issues and factors contribute in those people in terms of their health outcomes? And how does the healthcare system impact how individuals may or may not be able to get the type of care that they need? But we also focus along the lines of broader, going from the individual to the environment around them. So the area-based, the neighborhoods around them, what's causing people to come together as a community or become fragmented? What are the opportunities for people to get care, to advance? So these are things that we're studying in GOAL, but and there are many of us that function along the lines of this in our daily personal lives and professional lives. I know many of you work in this space. You are doing things along the lines of individual social determinants and area-based social determinants. So how can you contribute to the discussion? How can I learn from you? We at GOAL, how can we give you the data that we're putting together so that we can paint the picture in this corner of what influences lupus? So let's go to the top. I mean, this is maybe some of the more obvious ones. You know, I'm a physician. We have other physicians on this call, and in our community, we're treating them clinically. We know about the manifestations, the features clinically that occur in lupus, and we're fortunate to have an amazing cadre of basic scientists, immunologists that are working with us in our institution and other great institutions in our state to better understand the inflammatory process, the autoimmune process. So that's important. And so we have a whole community beyond just what's at Emory, who's at our meeting right now, that we need to bring into the fold so that we can have this crosstalk and advance clinical understanding, treatment outcomes, clinical trials, the development of therapeutics. And then, so we have up top the biology, the clinical aspects. On the bottom, we have the environment around us in terms of a social context. And then all of that meets in the middle and becomes better or worse, or it changes, it amplifies or gets dampened in a variety of ways by these groups of things that we call mediators and moderators, the stuff that is still all around us that can change things. Our behaviors. We have bad behaviors like smoking that, given the biology of lupus and given the social environment, that can drive people to smoke more, that makes the biology worse, and that makes the outcomes worse. So we have access to care, we have different aspects of the social support that people interact with when they have lupus, the treatment obviously, and how people cope. And so I know that many of you are in this very broad space. Are you working along the lines of the treatments and getting access to them? What about counseling and psychology or mental health support? The behaviors in terms of education, improving self-management. So that's a huge space right here. And everything that I've kind of mentioned very broadly and very quickly impact what happens on the right here. And that's this big group of outcomes where we're looking at things along the lines of what happens to the disease itself with lupus, the inflammation, the damage, but maybe more specifically what happens in the cardiovascular system and the kidney system. Because this happens so much to women of childbearing potential, we're talking about, birth outcomes are important. Patient-centered outcomes, meaning, what's important to people, their quality of life, their ability to work and to maintain employment. What also about mental health and depression, anxiety, other aspects of counseling. And then finally, healthcare utilization, people that are in healthcare or finance, we worry about the cost, the access, the quality of the care that we give. So, all this to say, I started talking about social determinants and how it really is just all encompassing around us and very important in health. And even in that area, so many of us are involved. But when we expand beyond social determinants and how the universe of factors that affect individuals' lives with lupus go into biology and go into demographics and access to care and treatments, when you take a step back, this is a picture of who we are as a collaborative. We are here to tackle social determinants. We're here to tackle the clinical care and the biology. We're here to tackle access. We're here to help improve how people cope and support each other and give them education so that they can have the proper behaviors that maximize their ability to improve their outcomes that they want. Not only just in the lines of what's defined here to the right, but how they want to define their lives. So this is a charge for all of us just to continue to work together and just to crosstalk. And this has always been the vision that my colleagues and others have had from the very beginning of the GCLEA and this collaborative. And I want to thank all of them and all of you for building step by step to the point where we're really going to be starting to make some tangible differences more and more. We've already made many steps, and I'm looking forward to many more. This is my last slide. This is just to point out that we're here at Goal and at Emory to help. This just gives you a sense that along all of those things that I mentioned, you know, depression as an example right here, we're collecting through the Goal cohort validated instruments. These things are all sort of in the scientific literature of survey instruments that give very specific data that's been accepted by the scientific community. And so we have a lot of information along a lot of these things. If we can provide information to any of you that is helpful, please let us know, and we're here to learn from you as well. That's it. Thank you very much.
Thank you, Dr. Lim, for that presentation. I'm sure all of us are thinking about how we can really begin working hard on projects that can really help people living with lupus and their families as well. That gives me a lot to think about, just myself alone. We are going to now just talk about political determinants of health. Our presenters are Representative Kim Schofield and State Senator Tanya Anderson. To tell you a little bit about both of them, Senator Anderson was elected to the state Senate in 2016. I'm happy to say that she is my state senator. I'm very happy that she's been my state senator for a number of years. She represents the 43rd district, which encompasses DeKalb County, Rockdale County, and Newton counties. She served as mayor of the city of Lithonia. She retired from the United States Air Force Reserve in 2012 after more than 21 honorable years of service, and she continues to volunteer and advocate for veteran services. In addition, she volunteers in the community through local senior centers, the National Council for Negro Women, the NAACP, and 100 Black Women. As a former board member, she continually, as a former board member of the United Way, she continually serves as a volunteer for DeKalb County Board of Health through Live Healthy DeKalb initiatives. State Representative Kim Schofield is the vice chair of the Georgia Council on Lupus Education and Awareness. She represents the 60th district of Georgia, which encompasses Hateville, East Point, College Park, and Forest Park. She sits on the Health and Human Services Committee and Small Business Committee as a member of our state house. She holds a master's degree in theology and organizational leadership, as well as working on her doctorate from Oral Roberts University. When she's not tackling lupus, she is employed by Emory University School of Medicine Division of Rheumatology, and she also works as a self-development strategist. At this time, I'd like to welcome and thank both State Representatives Kim Schofield and State Senator Tanya Anderson for speaking to us today. And I'm going to share my screen with you now. Share my screen. Carrie, can you move the screen over?
Chris, I'm going to advance those slides.
Okay, perfect. Thank you.
Oh, Kim, just tell me when, next slide, okay?
All right.
Oh, wait, I don't know why that is not in there. Okay, guys, hold on. Tech issue, just 1 second. I apologize, you guys. Okay. Kim, just give me 1 second to get the one with your
Okay,
slide.
that's fine, Terry. After what just happened to me, you're fine.
Okay, you guys I thought I had your slides embedded in there, and I obviously don't, so let me just pull them up.
I think it's a few slides after where Brandy's picture was.
No, that's actually Chris's. So just give me 1 second, please. I apologize.
Y'all are looking very good. Everybody's looking lovely.
It's certainly good to see all of you. Many of you were on our call last year, and we have been through a lot, so it's good to actually see all of your faces. I've worked with a lot of you in various capacities, and it's amazing that we can certainly all be on today and smiling and happy. So, and hopefully next year we will all do this again in person. I'm certainly looking forward to that, to doing that. I think we're due for in person.
Yes.
Meeting.
Drinks are on Chris.
There we go. Okay. Well, and this is being recorded too, Sam.
That's right. That's why I said it.
All right. We'll have to figure out a place.
I have it up, and I apologize. Here we go.
That's all right, Terry.
Dang. There we go. Can you see it now?
Yes.
Yeah.
Okay. Okay, Kim, you're up. And just tell me when to advance the slides for you.
So Representative Schofield has asked me to begin. And so my name is Tanya Anderson again, and I am so delighted to be here with you this evening. I am even more honored to serve on the board so that we can make our leaders in Georgia aware of the lupus crisis that has entered in Georgia, and to also educate and inform them that we are here to make sure that the political determinants of health, the social determinants of health, and all of the educational tools that we need to inform them of how we can better serve our lupus citizens is what we are here to do as elected officials. So the political determinants of health, it is defined as the creators of structural conditions and the social drivers, including poor environmental conditions, inadequate transportation, unsafe neighborhoods, and lack of healthy food options. They all affect other dynamics of health. Daniel Dawes, 2020. Social determinants of health is defined as the conditions and the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of outcomes and risks. Healthy People 2020 CDC. Those are quotes and definitions from those organizations. And at the end of the day, that is where it begins. It begins with an education of how we got here. You know, what's happening? How can we change it? Okay, next slide. So political determinants of health. Why is health political? Why is it political? Certain environments make it political, but one of the reasons is because it is unevenly distributed. We just saw on the previous slide how unevenly distributed it is. Number 2 reason, health determinants are dependent on political action. And that comes from a wide range of reasons. But then number 3 is health is a critical dimension of human rights and citizenship. So what we do know is that we're living in right now a very historic moment. COVID-19 has taken a toll on everyone. Many of us know that the pandemic hit us very hard, but it hit communities who are most marginalized, most vulnerable, who have lack of access to quality health care. Those communities were hit the hardest. Unfortunately, this is nothing new, but the pandemic brought it to light and exposed it. Years of medical studies have shown how a lack of access to quality, affordable health care has left vulnerable communities at a huge health disadvantage. As more and more individuals and institutions recognize the structural and institutional barriers to health equity, we must stop tiptoeing around the issue and introduce a new framework that disrupts the status quo and gets to the true drivers of the disparities. Real conversations need to happen at this point. The political determinants of health create the social drivers. And as I mentioned, those include poor environmental conditions, inadequate transportation, unsafe neighborhoods, a lack of healthy food options. They all affect the dynamics of quality health. But by better understanding these determinants, their origins, and their impact on the equitable distribution of opportunities and resources, we can better equip state legislators to develop and implement actionable legislative policies and solutions to close the health gap. Now to Representative Schofield.
So more importantly, the political health message, and good evening, everyone. Thank you all for being here. This is really important to us when we talk about political determinants of health, because the factor of how politics plays into health is determined by not only the distribution of money and power, but how the resources are distributed on a national and local level. So in this political space, as we know, we continue to address how it's impacted, why, who's impacted, make decisions about the resources that are to be owned, used, produced, and distributed. We are the policy makers. So in order for us to get a comprehensive look at how we address these political determinants of health that align with the social determinants of health, we're gonna have to be a little bit more intentional on how the public health arena really does align with political climate. So we are going to have to address, again, outside of the normal continual health continuum, but legislators have to look at ways to re-examine the legislative policy. And so Representative Senator Anderson and I, when we talk about health, the political determinants of health, we're looking at things and policies around, Terry, you can advance the next slide, please. Transportation, again, food scarcity or securities. And when we talk about transportation, it's more than just, do people have access to a car? It is really how far away the local medical center is, how their commute. And we look at all areas when we're designing transportation and we're looking at policies. We have to, as legislators, start thinking about how does this help or hurt our constituents or our base of people that have a chronic disease. Secondly, again, the food securities, accessing not only healthy food, but looking at the intentionality of neighborhoods that are oversaturated with fast foods and other unhealthy issues that relate to food scarcity, lack of restaurants, the availability. Other things that we consider are the safe neighborhoods, which we've already discussed about the effects on crime and environments that impact our ability to have a quality of life. When you look at communities that are of color, we don't have a lot of green space. How does that impact us when we're making policy decisions about the environment? And also improving the environmental conditions such as soil, water, air quality. The other big key factor is closing the technology gap. Sam will say a little bit more about our initiatives with telehealth, telemedicine, but expanding broadband. So when we're writing policy, all of these things come into play because it's not just about the state as a whole. You have to look at the people that are in the state and what are the barriers that they're facing. Unemployment, what policies are needed for people working and living with a chronic disease. Workforce development, what's the policy for recruitment and retention in healthcare that immediately impact and address especially some of the needs for the lack of medical professionals, especially in underserved areas and rural areas. So next one. Senator Anderson, some solutions.
I'm sorry, I needed to unmute myself. So better policies that address these key areas. Public health and the medical community must become more vocal about how health and politics are framed by the political culture and by the differing degrees, various forms of power by interests and ideologies of the policymaker. Now, this is in a nutshell says that if the policymaker does not understand the citizens that they serve or understand the disparities or the barriers that people face in healthcare, then it is somewhat a hurdle to overcome because we have to first spend time on educating the policymaker. Secondly, accountability for equitable distribution of diverse resources. Public health and the medical community must show how political decisions have led to growing health inequities, inequalities, and increasing rates of disease and death, and demand more interventions to address the disparities and equity. This is again, it follows with educating the legislator and giving an opportunity for them to be able to understand how they can better serve the citizens of the state of Georgia. And then there's evidence-based data collection, and we need to expand lupus data collection across Georgia so that the health communities are having a conversation with the underserved communities and the legislator, and we can get Georgia to a healthier place all around.
So in closing, I'll just say that health is political. Everything that you touch that around healthcare is based on a political premise. And we have to do better in the public health arena and I understand, many on this phone are already connected, but we've got to figure out a different strategy to get the attention of the policymakers so that everything that comes across our desk on the floor that we're asking in our mind, how does this affect people that are living with chronic disease? Because everything we make affects somebody. And so I'll stop there and I'll save any questions till the end. I know Senator Anderson has to run to another Zoom, but I just I'll be on the call, but want you to understand that political determinants of health is as real as social determinants of health. And I don't believe you can separate, it's an either or, there's got to be an and. Thank you.
Absolutely.
Thank you, Senator Anderson and Representative Schofield for your presentation. It certainly makes me certainly think as advocacy chair for the LFA on how we can really work with the patients, the activists, the advocates that we work with on a better basis so that when we go to the Capitol, we can really make a difference. So I really appreciate that. We are now going to talk about the role of community health in lupus. And I'm going to introduce Brandy Sylvan. Terry, do you have slides?
I have the slides, Chris.
Oh, you do? Okay. Brandy Sylvan serves as Director of Government Affairs for the Department of Community Health. In this role, Brandy is a liaison between the department and other government entities. She also oversees the constituent services team and works to help citizens navigate various programs at the agency. Brandy has been working with the Georgia Council on Lupus Education and Awareness to provide administrative support since its inception. She has been certainly a guide, and the council really could not exist without Brandy's continued support, advice, and assistance. So I'd like to welcome Ms. Brandy Sylvan.
Thank you, Chris. That was a very nice introduction, and I've certainly appreciated the opportunity to work with the council and get to know each of you and get to know more just about lupus in general and about what we're seeing in Georgia. So I'm here today just to talk to you all about, let me see, make sure I'm sharing my screen. The role that the Department of Community Health plays with lupus in general and with the Lupus Council. We always like to do any departmental slideshows. We like to start with sharing our mission and purpose. So the mission of the department is to provide access to affordable, quality health care to Georgians through effective planning, purchasing, and oversight. Our commissioner likes to joke that we are really just a regulatory, finance, and compliance agency. So a lot of our role is on the back end, but that is what we are striving to work towards. The purpose of the department is to shape the future of a healthy Georgia by improving access and ensuring quality to strengthen the communities we serve. So I'm going to start just by giving you a little bit of an overview of the department. It is one of 4 state health agencies, the others being the Department of Public Health, the Department of Behavioral Health and Developmental Disabilities, and the Department of Human Services. Frank Berry is the commissioner, and he has served in that role since 2016. He was appointed by Governor Deal and reappointed by Governor Kemp. DCH has several large programs under our purview, including Medicaid, the State Health Benefit Plan, Healthcare Facility Regulation, the Office of Health Planning, which issues certificates of need, the State Office of Rural Health, and other attached divisions. Our employees are based in Atlanta, Cordele, and throughout the state on our facility regulation side. So first I wanted to kind of talk with you about the Medicaid program in Georgia. Each state has to designate a single agency to be the Medicaid agency for the state. So DCH serves as the state agency for Medicaid in Georgia. We do have some roles that DBHDD and DFACS play, but those are contracted out, and essentially we are the single state agency in the state for Medicaid. There are currently over 2 million Georgians enrolled in one of our different medical assistance plans. That would include Medicaid, as well as Peach Care for Kids. Over half of all births in the state are covered by Medicaid. And some of the programs that are included include low-income Medicaid for several different categories of eligibility, Peach Care for Kids, and waiver programs that provide for home and community-based services. Some of the efforts that Medicaid can take to support members with lupus. So most of our Medicaid members are supported by a care management organization. In Georgia, the CMOs are AmeriGroup, CareSource, and Peach State. There used to be a 4th, WellCare, but they recently merged with Peach State. Each of these CMOs have a disease management team that educate members about managing chronic illnesses, including lupus. During the pandemic, our CMO care coordinators increased outreach to members to ensure they could continue to get access to services, and that included increasing the use of telehealth medicine. In order to assist members with pharmaceutical needs, the CMOs also conducted outreach to ensure that they were able to obtain their medications on time. The State Health Benefit Plan, DCH serves as the administrator of this insurance plan that covers state employees, teachers, and school system employees, as well as their dependents and eligible retirees. There are currently over 650,000 covered lives, and this is one of the largest plans in the nation. Our members are able to choose from plans offered by 3 different administrators. That's Anthem, Blue Cross Blue Shield, United Healthcare, and Kaiser Permanente. SHBP's role with members with lupus, they also have case management services and complex case management services at no cost to members. Case managers can help coach members about lupus symptoms, the management of lupus, treatments, and social determinants of health. We do offer some wellness programs for our members that allows them to offset out-of-pocket costs by completing various wellness activities. I added this in, the State Office of Rural Health is not usually one that I would necessarily highlight in a DCH overview presentation, but I feel like in the context of the Lupus Council, this is a pretty significant one. So every state has to designate a State Office of Rural Health. In Georgia, that is held under the umbrella of the Department of Community Health. That office is based in Cordele, Georgia. And the directive of this office is to improve access to healthcare in rural and underserved areas and to reduce health status disparities. The State Office of Rural Health provides funding that links small rural communities with state and federal resources. In fiscal year 20, they managed over $25 million in grant awards. Through its various programs, the State Office of Rural Health supports rural hospitals, primary care offices, and also has a migrant farm worker program. Now to touch on how DCH kind of became connected with the Lupus Council. The Georgia Council on Lupus Education and Awareness, which is the formal name for the Lupus Council, was created in 2014 by the Georgia General Assembly with the directive to research improving education about lupus throughout the state and to help identify healthcare services available to individuals living with lupus. The department provides administrative support to the council, which includes assisting with the distribution of some grant funds that the council receives each year. The department does hold a seat on the council, and that is currently filled by SHBP's Deputy Executive Director, Kathy Craven. Kathy is, she oversees the clinical and quality programs in the State Health Benefit Plan, which really makes her a really great fit for the council because a lot of her goals for the program align with the goals of the council. And that's all I have, but I certainly am open to any questions that you all may have.
Hey, Brandy, actually, I have a question. It's Sam.
Hi.
Hi. Thanks for the great talk and overview. I learned actually a few things too. When you talk about Medicaid, Medicaid is so important in people as a whole who live with lupus. We know from our goal cohort that about 30% of the entire population in Atlanta anyway of people with lupus have Medicaid. And so when I can see us kind of talking about what we may be wanting to do or able to do in terms of advocating for Medicaid expansion or things along those lines. Are there any restrictions as to how we can function in the GCLEA? You know, I know there may be issues with regards to like political advocacy and things like that. You know, I view the collaborative as an independent group that the GCLEA facilitates, but I just want to make sure that we're all sort of on the same page as we kind of discuss these sort of topics.
Sure. And, you know, as you're certainly aware, the council does have the ability through its legislative authority to issue recommendations. And, you know, what that scope entails is up to the council. And certainly the department is always happy to work with you in examining those.
Thank you.
So I'd like to take a moment to introduce, we have another legislator that's been very influential and helpful in the space of health equity and healthcare. Senator Kirkpatrick, Kay Kirkpatrick is on the phone. Senator, would you like to say a few words to us? I know you had some legislation you had worked on.
Sure, glad to be with you all. I just wanted to point out that lupus patients, as well as a lot of other patients, deal with a lot of complications with the insurance industry, getting approval for various things. And for that reason, I worked really hard this year to get Senate Bill 80 passed, which puts some guardrails around the prior authorization process and adds transparency to that process. The bill wasn't everything that everybody wanted, but I do intend to continue working on that next session. And there are a lot of people on both sides of the aisle working on healthcare issues. And those are not specific to lupus, but I think anything that we can do to move the ball down the field in the legislature benefits all patients, lupus patients and other patients. So thank you very much.
Thank you. Turn it back over to Chris.
Thank you, Senator Kirkpatrick, for your statements and offering, and certainly being here on this call. It's very important that we have members of our legislature listening in and learning what certainly they can do to contribute to the cause. I certainly appreciate you being on this call today. We have only a few minutes. I think we ran over a little bit. We do have one additional question that was asked. That was by Dr. Janetta Mpofu from the CDC. Her question, I think, is directed at Dr. Lim. Have you had a chance, her question is, have you had a chance to investigate the ways positive factors like social support at home, school, work, or neighborhood environments influence health outcomes for lupus patients? And as a follow-up to that, how do these factors vary by socioeconomic factors as well?
Yeah, thanks, Chris. I actually, Janetta and I were kind of talking privately, but just to let everybody in, we are looking at aspects of social support, but you know, all the things that she mentioned in that statement, it's obviously very broad, and there are a lot of specifics and nuances that can be teased out that are important to do so. So there's a lot of room there in that space. Even though we say we're working on social support, there's so many other questions that we just don't have the bandwidth. So we welcome people like Dr. Mpofu and anyone else who would be interested and have the skills, or have any external collaborators that would bring in to kind of help us look into that data further.
Thank you, Dr. Lim. One question I had, and it may be, you may be in the cusp of studying this, but looking at a correlation between the level of depression or indications that patients are at various levels of depression and loss of job, and I think your other chart was kidney disease, renal disease. So have you found necessarily or seen or conducted any studies that find correlations between the levels of each?
Yeah, I mean, it's known that depression is very prevalent in people with lupus in general. But, you know, I think beyond that, especially in our community here in Georgia, given the social and political factors that influence health, it really, and the 40% in terms of poverty, I mean, you know, the burden and really the qualitative aspect of the depression is really profound. We feel that it really drives the trajectory of people's health very significantly in our part of the world, if you will. Specifically, Dr. Drenkard and our team has led some research with regards to depression in people with cutaneous lupus and how it impacts their disease as well as their outcomes and their quality of life. The aspects of the depression that we want to also look into is kind of as to what really feeds into that and kind of how it really impacts the outcomes and the details of that. What does that depression mean in terms of how people respond to that or not respond to that, how it impacts their care, seeking of care, their access of issues, how it impacts them biologically. And those are kind of active projects that we're looking at now.
Thank you. Thank you very much, Dr. Lim. All right, so so that we remain on time, we're going to move to our next topic, which are some of the current initiatives that are being worked on that are connected to the GCLEA and the work that it has done. I'm going to start the presentation actually with my own topic, discuss our school nurses project. Thank you. So in 2016, you can go on and advance the slide, Terry. In 2017, the GCLEA initially received a contract from the American College of Rheumatology, the Lupus Initiative, and the National Association of Chronic Disease Directors, with funding from the Centers for Disease Control and Prevention to work on a number of initiatives tailored to lupus and social determinants of health. One of the areas that we decided to focus on as GCLEA was school nurses and school health. And so we began, Kim Schofield and myself began working on the school nurses project in 2017. In that time, we had partnered with the Lupus Foundation of America Georgia chapter, and now the LFA has taken on the project as it's taken much more of a leadership role in the project itself, basically naming me as the principal investigator or project manager on that project. We, in time between 2017 and 2020, we have been able to facilitate training programs through Metro Atlanta and Fulton County, Atlanta Public Schools, Gwinnett County, Cobb County. And we hope to follow those schools as well as those school nurses for the next 5 years to really understand what impact our training has provided to each of the school nurses who did receive our initial training. The LFA and the GCLA also help develop the presentations that are given, the training materials that are given to teach each of the school nurses. And we were also involved in actually putting together the guidance to caring for students with lupus plan, essentially, which is a care plan that does assist both the school nurse, the patient, the parent, and the doctor in learning how to help the student manage their lupus definitely throughout the school day, but throughout their high school career. We also developed the American College of Rheumatology's guidance to independent self-care for students living with lupus. And this plan is used to assist those who are typically graduating seniors from high school. This project and this plan was specifically developed to help those students learn how to manage their lupus on an independent level as they begin to move back out into the adult world and begin to learn how to use things like health insurance, medication, without the necessary assistance of their immediate assistance of their family. Next slide. Terry, next slide. Thank you. So our 5-year contract with the American College of Rheumatology ended in 2020, and the CDC was able to provide the ACR with a new contract, which started January of this year. It's another 5-year contract through the American College of Rheumatology and the National Association of Chronic Disease Directors. In the next 5 years, we hope to not only follow the school nurses who were involved in our previous training programs and who have received our care plans, but also follow schools, other schools and other school districts here in Georgia for the next 5 years. This year, we hope to facilitate at least 2 training programs this year in Southeast Georgia, with a goal of training at least 30 school nurses in Southeast by July 31st, 2020. Those counties are Appling County, Bullitt County, Burke County, Emmanuel County, and Jenkins County school districts. And those are both planned for July, the last week of July. Each of those counties were picked because 50% of the students in each county are on or are eligible for reduced price lunch programs, which was a requirement of the contract this year. As has been done in previous years, each of the school nurses are trained by pediatric rheumatology fellows provided by Children's Healthcare of Atlanta. And all of the training modules have been developed as last year by ACR and ACDD and members of the project. We are currently, all materials are being studied by KDHRC for this project, this specific project. The evaluations are going to be issued to all of the school nurses, and each of the school nurses will be followed over the course of the next few years to see, one, how they utilize those materials, but also help us learn whether or not those school nurses have been able to assist in the care of someone living with lupus, or even assist or facilitate the diagnosis of a student living with lupus. Next slide. Let's see. Some of our goals include also tracking the number of students living with lupus in the 5 counties that I mentioned. And so what we've done is we've already entered into an agreement with the 5 counties here in Metro Atlanta to begin tracking the number of students living with lupus. And we wish to do the same in Southeast Georgia. And so we're currently working on that with each of the counties so that we can begin learning, really understanding and learning how those students, how many students are living with lupus and how many are actually using our plans. Again, like I said, we are evaluating those plans. Let's see. And our goal for at least this next year is to at least train 200 school nurses by July 31st, 2022. Next slide. Of course, we are not in a bubble in this project. After we started in 2017, working on the school nurses project, Florida, Alabama, and now Pennsylvania are also involved and have similar projects in their states. And we're all working under contract with the ACR and ACDD to really train school nurses as much as we can in our respective states. Hopefully with all of the information that we gained as a result of the evaluations over the course of the next 5 years during our second period of contract, we hope to really find out more information about how these plans can certainly be used throughout the state and to assist students who are living with lupus. We've already talked to the National Association of School Nurses about implementing this type of program, or at least helping in the implementation of this program throughout the US. And we really hope that the care plans that we're providing, the training modules that we're currently used will be used to assist people, students who are living with lupus throughout the U.S. One of the reasons why this program means so much for me is that I was diagnosed with lupus in high school, and I really found just in being involved in this program, I've begun to really understand some of the things that I missed as someone living in lupus. And in high school, I missed a lot of things and a lot of support that I really could have had I had a school nurse to assist me. And this has been a great opportunity certainly for me to really engage with school nurses in many different counties to learn how they're working with students who are living with chronic illnesses. I'd also like to certainly thank Dr. Kelly Roster-Stevens, who's on this call, who has been a great help in providing us with pediatric rheumatology fellows. Anytime I certainly ask for her assistance, she is there for us. And we have a wonderful working relationship as we both work on this project. I'm certainly open to any questions you may have. I think I'm going to pass it on to Dr. Lim, who is going to talk about telemedicine.
Thank you, Chris. All right. We were working and talking about telemedicine for years, and it's so fortuitous with this pandemic how this is just like second nature now, right? But let me just share briefly about what we learned as part of GOAL. We actually sent out an additional smaller survey on earlier this year in partnership with the people that you see at the top of the screen there. It was in January through March of 2021, really sort of at the height of the pandemic, if you will. And we sent a survey that covered a variety of different topics around telemedicine, its perceptions, and we were curious as to some features regarding sociodemographics. We had 732 respondents, most of whom were female. The 78% self-identified as Black. A little over a quarter were living in poverty. And although 40% were employed, a third were unemployed, and about a quarter were off the workforce, meaning they were either disabled, retired, a student, or homemaker. And the Black participants were more frequently in poverty, 32% versus 8.3% versus the non-Blacks, and were less likely to be employed. So in terms of telemedicine, 74% had a telemedicine visit during the pandemic during that period of time, with the vast majority having a decent internet connection. And there were really no differences by race, age group, or work status. People with lupus who were Black were more involved in their care, which was interesting with telemedicine. They also were significantly following their doctor's advice, reportedly in a better way than the non-Black participants who responded. And they were also more satisfied in terms of their interaction with especially ancillary staff like nursing. As you might expect, being in poverty was associated with less satisfaction with telemedicine, and also finding video visits less convenient if you were in poverty. However, those in poverty followed their doctor's advice better, and being younger was associated with higher satisfaction with telemedicine. And so one of the conclusions out of this sort of query of this initial survey was that telemedicine may potentially offer an opportunity to mitigate health disparities through the pandemic and beyond, which is so critical, as I mentioned earlier, in lupus that we all know. So we had these strong suspicions before. We used the prevalence and incidence estimates from the Georgia Lupus Registry that the CDC funded And these were rates coming out of the Atlanta area. We applied these rates to census figures from the rest of the state in terms of the counties. And we basically drew up a map with estimated counts of individuals with lupus based on those rates and the age group and the race and ethnicity makeup of that county. And so you can see the density of people with lupus around some areas that are related to more metropolitan and maybe perhaps access to care and educational and work opportunities. But what many of us also see here in this map are not really necessarily the dark areas where we would already know, but I personally am so curious and passionate about all of those areas in between. So if we're going to really be the GCLEA, where we're representing the entire state, we need to know what's going on in the rural areas and outside of the big metropolitan areas, and to help our fellow citizens there. It's hard enough as it is when you are in Atlanta, when there are tons of healthcare systems and rheumatologists and pediatric rheumatologists. Imagine my suspicion and a lot of people's suspicions, imagine how heightened the disparities, the barriers are, and perhaps even some new issues that serve as further barriers when you're in a rural environment. So that's really behind kind of the genesis behind trying to leverage the state's network of telemedicine facilities so that we can be able to try to facilitate care. But in addition to that, we are weaving into this a public health surveillance component that leverages what we have put together in goal. So this is our plan for the upcoming fiscal year. So next year, what we're hoping to do is build on what we've already done, and that is to build on the relationships that we've developed with the Dougherty County Health Department. We've already done a pilot project there to test out their system. We know that they have the facilities. We know that there are people in that area who suffer from lupus. There probably are people who are not yet diagnosed or will be soon. And so we need to continue to build on that to provide an opportunity for those who are underinsured or uninsured, or who have difficulty going to providers or traveling to them, and that could utilize a telemedicine, telehealth system that's already in their backyard, and connect with providers that are in Atlanta or Augusta or Macon or other places that would have volunteer rheumatologists, nephrologists, and dermatologists to facilitate their care. So we'll continue to build on that and actually implement that in a broader fashion. And in order to do that, we need to engage the providers in that area. So there's a Project ECHO program that came out of the University of New Mexico. It basically is a virtual format where specialists in academic centers like where I am, we don't interact with the on-the-ground primary care physicians in the communities in areas like rural Georgia. And so it's a program that's built on facilitating interaction through a virtual environment where there's like monthly or regular teaching, a short didactic session where experts are brought in from that academic center, and it's like a teaching environment that the primary care physicians or dermatologists or nephrologists in that rural area, for example, in Georgia, can come in and learn more about lupus. And at the same time, the specialists in the academic centers can learn about the needs and issues in the rural areas, and sort of their relationship builds. So Project ECHO is already being implemented in a variety of conditions through the Department of Public Health. DPH in Georgia. So I've talked to Rana Bayakli, who's in DPH and serves on our council, and we're starting to develop that. And so we want to engage the community, not just go in and say, here, we're Atlanta rheumatologists, we're going to give you the care, we know better, but we want to be part of their community and to bridge that and to partner with the providers and the communities that are there. So Project ECHO is one main way to do that. And we eventually want to then take that model and keep pushing ourselves to expand. We're not going to just focus on Dougherty County. The next county that we pick for a variety of reasons is Chatham County. And that we want to use the same model of engaging the county health department, engaging the providers through Project ECHO, and then building that relationship and feeding people who need the care into the health departments that are there, and to ultimately expand to other parts of the state. So the public health surveillance part is rolling goal into this model. And hopefully I demonstrated to you earlier that goal is an infrastructure by which we can learn so much about what's happening. And after we implement something, we can learn about the results as well. So we can use what we already have in place in terms of the infrastructure of goal to recruit and enroll the residents in these rural counties that are being seen in the county health departments, that are being engaged by the providers through the Project ECHO. And so that we would ultimately be able to have goal that is truly Georgians, not just Atlantans organized against lupus. It'll provide us a way to compare and contrast what's happening in the metropolitan areas versus the rural areas, and also provide a way to better understand the needs of what's going on specifically in those areas outside of metropolitan parts of the state. So hopefully this will be a project that truly expands to other parts of the state, becomes statewide in that regard. And along this journey, we will definitely engage and seek support and guidance from you all. We need all of your expertise. There are many of you that work in this space that understand what's required so much better than any of us do. And so again, going back to that model where we're all together fitting different pieces of the puzzle together, this is certainly one specific example where we're going to lean on the collaborative to help us. So I look forward to telling you more about how this develops, and even more specifically, how you as a collaborative can help join us and be engaged in the process. Thank you. So do I go into the next steps? Okay. Can I have the screen back, please? Sharing, thank you. Sorry about that, guys. All right, so we're almost towards the end here, and we want to talk about next steps. I want to personally apologize about the time that's passed since our last meeting. I mean, the pandemic's great in the sense that it's a great excuse for many things, and that certainly was not a small issue that occurred. And we also had a transition from Chris's great leadership into some new members of the council, and you add all that up together, and that's, I think, what really contributed to the gap. But we don't want to have that happen again, at least to that degree. And we will be having more regular meetings that have clear aims and goals, and effective discussion, not just all sort of listening, but to be more engaging and to have something come out of these discussions. So you see here some dates and times that we've proposed, and you'll get more information about this later, so you don't have to worry about writing them down. And we will aim to definitely get out save the date notices as early as possible. But these are what we have planned. And you'll notice that the first one is around a grant discussion. So let me go into that, and I'll follow up and see if Kim has anything to add, and we can see if people have any questions. So this grant that we alluded to in the previous slide is something new to the collaborative and to the citizens of Georgia. The overall aim, and I'll talk about the aim in this slide in a second, the overall aim as it relates to how the council came up with this and why we're unfolding it in front of the collaborative first is that it really underscores the philosophy behind the relationship that is there between the collaborative and the council. The council is like a board of directors, really. You know, we're a group of people that have the ability and some resources and connections to get things going, but it's a small group. There are five, six of us, and that number of people, we're best at directing and engaging individuals, equipping people, providing vision, direction, providing support. And that in large part is how the collaborative came about, is that it's an extension of who we are. You all are individuals that are in the field that have doing wonderful work in what you do personally and professionally. And we need to talk to each other and engage each other. And so we've been laying that foundation. Now we really want to grease that wheel. We want to provide even more fuel to the fire. We want to provide that laser focus by starting off with this grant opportunity. So part of the grant that the council gets from the state, we want to use these funds to then give to you all. And the aim is obviously to improve the lives of citizens of Georgia who live with lupus or their caretakers by supporting worthy individuals and organizations that aspire to the council's mission statements and goals. It's very broad, but you know where we want to go. We want to improve the lives of those with lupus and or their caretakers. And we want different people of the collaborative to collaborate together and to come up with a project. And not just in concept, but we want to give you the resources to do so. And a part of that will be with a grant or grants that total up to $25,000. The preference will be given to Georgia residents and organizations. There's also a priority in terms of having projects that have a higher probability of success, as well as not just in the short term, but to have at least some potential to be sustainable beyond this initial grant. But we want to kickstart that. We'll have that first meeting on July 29th to give you some more detail about that. It'll be followed up with additional information that'll come out, but the proposals will be due in plenty of time after that initial meeting for you to come up together, but it'll be due early in 2020. And then the funding recommendations will be soon thereafter so that people can get started very quickly. And we expect the project to be relatively complete to the point where you can produce a report as to what worked, what didn't work, and so forth, and your plan moving forward by June. So we'd have several months. So before early 2022, we want to use part of some of those other meetings that we'll be having to give opportunities for people to better understand what others' capabilities and interests are, to start gathering together around certain ideas and projects. We have Mina, who's a great administrative support on our staff and the council. We have other resources through DCH and DPH. We can help bring together smaller groups outside of these meetings if you wanted to talk more in detail. We want to give you the tools so that at the end of the day, you've come together excited, met new people, have found great opportunities to work together, and you have extra money in your pockets to be able to do something that you never would have thought about doing before or thought you could do because you didn't have the resources to do so. We'll have an independent committee to review these things. It won't be the council initially to look at them. They'll score them. They'll make official recommendations for the funding to the council. And like I said, all of these things will be brought out in more detail in upcoming meetings by email and posted on our website in the coming months. So Kim, did you want to add anything before we?
I would just say this: you got my attention when you said you had some extra money and put some extra money in my pocket. So right then and there, I sparked up and said, but I just wanted to say to everyone, you guys are the brightest of the bright, the best of the best. And when it comes to lupus and boots on the ground, we know that COVID exposed a lot of gaps and things that we just didn't anticipate. And now we have an opportunity, and we're giving you, I wouldn't say a blank check, but there's a dollar amount, but we're giving you an opportunity to address some of these issues. So it wasn't by accident that you were pulled together, but it's because you have the knowledge to get us to the next level. So I just encourage everyone to stay engaged, share, and share. And we're here to support you. We've got to do it bigger and better this year. This is the time when we need to move forward. I think we're a little bit behind, but COVID gave us what I think was an electric shock to go forward. I see Nina shake in her head, so you agree with me. It's the time is now. So thank you. And I guess, Sam, we can open up to questions.
Yeah, sure. I mean, on anything really, but let us know if you have any questions.
Questions, comments. It's your time now. We're done talking.
In terms of the funding, just to make sure, is it open to this group and their partners, or pretty wide across the state? Like if there's another organization that maybe works in a different disease state, but they have connections, similar connections, or can help fulfill some of the needs of the Lupus Foundation in terms, or GCLEA, is that a potential partnership that could be eligible for funding, or are we still thinking about what that looks like?
Thank you for that question. I'll say that the GCLEA, the collaborative, the grant opportunity, these are public entities. This is from your tax dollars for the citizens of Georgia. We want to engage the best, and so if it involves an organization or an individual that has not yet participated on the collaborative, I mean, we welcome them if it strengthens the application.
Hey, will the GCLEA provide a request for proposal or a framework for the grant, or you'll go ahead and do that? Okay.
Yes, there'll be instructions and sections to complete, page limit. It'll be detailed so that you have the proper guidance.
Okay, awesome. Thank you.
As a national partner, I would love to know how the ACR can help support, the American College of Rheumatology can help support disseminating the opportunity, or anyone who's interested in applying. I'd love to know how we can play a role. Not as an applicant, just as a supporter.
Sure. We do require that the awardees are Georgia based. So we'll have to think about that, but thank you. But I do want to highlight the ACR as a potential collaborator You are good at that, and that's the amazing thing. If you look at the screen and you look at the list of people that have been in the collaborative, this is what we hope happens. It doesn't have to happen this way. It's not a requirement. But the reason we're sending this out through the collaborative initially is that we hope that you all spark some relationships that are brand new, that you really become creative and start getting together and say, hey, I thought of this idea. You too? Let's build, I can do this. Yeah, I want in on this as well, because I can provide that. And you start building, and maybe you meet a few times independently outside of the collaborative meetings, and you come and you create this idea that is just so amazing. We help kick it off the ground with this 25K, but then it's so good that corporations are donating money to it. I mean, that is the dream that we have, that I know that can come out of this group. And it's going to affect generations of people and improve the lives long after we've been on this council.
Chad, just a quick question. I know correct me if I'm wrong, that there were many other groups that wanted to share their contact information. I think had previously shared contact information. But would that information still be available to members of the collaborative? So
the contact list and information from the previous meetings? Correct.
I think if I remember correctly, our last evaluation had an option for individuals to be able to receive some sort of directory.
I don't want to say anything specific, but we'll talk about that. And the intent definitely is to facilitate the interaction. I remember that we wanted to make sure everybody gave their permission to provide their information publicly. So we want to make sure to do that. But yes, we want to help that interaction by giving contact information, and we'll discuss that. Oh, by the way, this initial meeting was just to get the momentum started up with some of the core people that you all have been with us before. We had some funding left. We got the Grubhub going, and I'm sorry about the issues with that. But thank you, Mina, for helping to make sure that you all get fed in some way. And Terry, you can talk a little bit later if you want about the other things that we'll provide for them. But this is not how we envision the collaborative meetings to be all the time. In fact, the rest of the collaborative meetings should be wide open. I mean, we want people to come in to see if they're interested, and hopefully come back, and we grow much bigger than where we are now. So yes, we want to engage. We want to provide information. We want to have people know who each other is and what they're doing.
Anything else? Any other questions, comments?
Yes. I have a question. I came in very late. I'm still seeing patients actually, and I just wanted to let you know that I'm very supportive. I've looked at the agenda, and Sam, I thank you for your comments. I did hear them, and Representative Schofield. Thank you, Terry, for getting me in. But I'd like to know if I could review the recording later, and is that available? And so I can put some emails, some input. Is that possible?
Yes, it will be available.
That would be great.
I'll get out earlier next time.
Dr. Elliott is one of the hardest working rheumatologists on the planet.
There are a few more.
Not many.
You do.
Good to see you, Dr. Elliott.
Same here, Sam, and all of you.
Anything else so we can wind up? Terry, do you have any housekeeping or anything else? We can give people back some minutes.
No, what we'll do is we will send out a survey following this meeting, probably tomorrow. And we'll take care of the Grubhub situation tomorrow as well and resolve that. And in the survey, we will ask permission to put together a directory so people can share information. I think that's an important note to do that.
Glad to see you, Chris. Glad that you're back at it. I just saw that he was out of whack for a while. I just heard.
Yeah, thank you
Praise
for
God.
that, Elliot.
Well, I mean, I miss the time that we would have now to just mill around and catch up personally. And I really miss seeing all the faces in a room. So I hope to see that soon. But until we meet again, whether it's virtual or in person, and by the way, we'll have a hybrid version, just like everything else that's going to be in this new world order. But I do hope to see many of you in person soon. But until then, please be safe. Thank you for your time on this busy evening to join us. And we really look forward to your contributions and your thoughts and having you help shape our efforts for the future. Thank you again.
Thank you, Sam.
Thank you, everyone.
Thank you.
Thank you. Thank you, Sam.
Thank you.
Night, everyone.
Night.
Good night.
Hi.
Thank you all. Good night.
Thank you. Good night.
Fun.